I have no one to talk to. And it hurts me so bad because I really wish I could sit down with my mom and talk to her, because I lost my dad in 2003, and he was the only pillar that I had, because my dad was very supportive.
And then on my father's side, he even disowned me. We don't talk, and he'll never pay for my fees. Hence, all my siblings are in the States, and I'm here in Africa, yeah.
The reason why I'm not happy, it's because I'm jobless. I don't have a place to stay. I'm living with a friend.
These constitute some of the challenges faced by people who make up minority groups in most parts of Africa. Lesbians, gays, bisexuals, transgender and intersexuals, collectively referred to as LGBTI people, do not only continue to face challenges in accessing health services, but remain at high risk to HIV infection due to discrimination, stigmatization and marginalization caused by homophobia. This film looks at the lives of LGBTI people in 3 African countries: Malawi, Swaziland and South Africa, and explores some of the challenges they face in attempting to exercise their sexual reproductive health rights.
When trying to access healthcare services in Swaziland as a lesbian, it's not so easy because a lot of people tend to judge you for who you are. A couple of times when you go to the hospital and you try to tell people what's wrong with you, the first thing, instead of acknowledging what you are coming to the hospital for, they want to ask you, not necessarily ask, but they tend to judge you based on, okay, for me, I dress more like a guy, if you may say it that way. So the first thing they'll ask me is if I'm a girl, and I'll tell them that yes, I am a girl, and then they would always want to know why I dress this way, what does it mean, why do I want to be a man, and I always get all these judgments, and sometimes you end up leaving the hospital without actually getting help because of the way that the people treat you.
The situation is even more challenging in Malawi. Not only do LGBTI people find it difficult to access healthcare services, but a significant number we spoke to had no means to have access, as their employment had been terminated as soon as their sexual orientation was discovered.
Actually, my boss came to my place. Yep. Lunch hour if it's not true. And then tinatengana ndi bwana angacha. Napita ku nyumba kwanga nakampesa girlfriend wanga ali kumekuja. Those bosses anazamfusa kuti, what are you doing here and who are you? And then my girlfriend told them the truth. After 2 days, my boss gave me a lady that you're fired.
I was working in a church setting as I was a media personnel in a certain church, a local church. Then I came out to my pastor because I wanted help. I told him that I'm gay, I have homosexual feelings, and they started treating me. They were like avoiding, they didn't want me to take part in some of their activities because they were saying that it would be controversial for a homosexual to work for God and people would not be happy with that. So they started sidelining me and I quit the church. I went to another church.
Compared to Malawi and Swaziland, South Africa has made more progress in ensuring that LGBTI people and key populations have access to healthcare services. However, although the right legal framework is in place, progress on the ground has been slow.
The policy and the constitution, the law, is very brilliant. in terms of implementation, it's not extended in the lived reality of LGBTI people. The challenges, it's the attitude in the health system. It's the attitude in the safety and security, the policing, and also in the community. There's still discrimination, there's still stigmatization and stereotypes that are happening in our community. So it's not extended to really the LGBTI population. Communities are not empowered, there's no promotion of rights and also protecting LGBTI communities in society.
My expectation, if we simply achieve a reduction in homophobia, I would be very happy. If we achieve increased respect of LGBTI people as human beings, I will be happy. But ultimately, the final goal is to ensure that people live freely, that they can express themselves, that they can access these important prevention services which they need. If we achieve that, I think we will have achieved our goal.